You know, in medicine, bleeding usually has a reason. Maybe you've had a bad scrape, surgery, or you're taking a blood thinner. But what if one day you find yourself bleeding and it just won't stop? That's exactly what happened to John. Picture this. It's an ordinary morning. John's in his kitchen, slicing vegetables. Suddenly, the knife slips. Ouch. A tiny cut on his finger, nothing dramatic. He cleans it up, presses a bandage on, and figures it's just another Tuesday. But 2 hours later, that tiny cut is still leaking blood. Not gushing, but enough to soak through the bandage, again and again. He's a little annoyed, but shrugs it off. By bedtime, though, he spots a dark purple bruise forming around the wound. Weird, right? The next morning, even weirder. John wakes up to new bruises on his arms and legs, places he doesn't even remember bumping. Now he's worried. So off to the doctor he goes. They run all the basics, blood count, totally normal, platelets, normal, clotting tests, PT, PTT, INR, all looking good. Doctor says, "You're fine," and sends John home. But the bleeding doesn't stop. Days go by, bruises keep popping up. John gets nosebleeds and his gums bleed when he brushes his teeth. He goes back. This time his doctor refers him to a hematologist, a blood specialist. Now things are officially suspicious. More tests. Von Willebrand factor? Fine. Platelet function? Normal. Liver function? All good. But then comes the mixing study. Here's how it works. John's plasma is mixed with healthy plasma. If he's missing a clotting factor, this should fix it, but for John, it doesn't. That's a big clue. It means something in his blood is stopping his clotting factors from working, even when the doctors try to help. Deeper tests reveal the culprit. John's immune system has started making antibodies that attack his factor VIII, a protein his blood needs to clot. This isn't inherited, this is acquired. It's called acquired hemophilia, and it's rare, like 1 in a million rare. No one knows why it happens. Sometimes it's tied to other illnesses or medications, but often, like with John, there's just no clear reason. The good news is, once doctors know what's going on, they can treat it. John starts on immunosuppressive therapy, basically dialing down his immune system. He also gets special clotting agents for when he starts bleeding. It takes a few months, but finally, John's bruises fade. His cuts heal like they should. The mysterious bleeding stops and life goes back to normal. John's story is a reminder. Sometimes medical mysteries hide in plain sight. Normal test results don't always mean normal health. Sometimes the body's own defenses turn against it, and it takes detective work to find the answer. Acquired factor VIII. Inhibitors are rare, but they show just how delicate the balance is inside us. If you found this story as fascinating as I did, make sure to subscribe for more episodes of the Curious Case Files, where ordinary symptoms become extraordinary mysteries. And remember, these cases are rare, and nothing replaces advice from your own doctor. Thanks for watching.